family caregivers. Who are they and why should we care about them? Family caregivers are those who provide care. This can be emotional, functional, financial. What is unique about this caregiving is that it is being provided in context of illness, disability, or age-related needs. They're mostly family members. They can also be friends or neighbors. What is important is to be aware of the distinction between family members and family caregivers. Let me give you my example. I'm married, we have 2 girls, we are a family. We support each other. However, it is my mother who provided 24/7 care for my ailing father for 8 years before he passed away last September is what made her a family caregiver. I can give many examples from my practice. It is the husband who provides round-the-clock care to his wife who suffers from Alzheimer's disease and rushes out for a few hours once a week to run errands, who is a family caregiver. It is the daughter who goes over to sleep every night at her mother's, as her mother suffers from paranoia and gets scared at night, who is a family caregiver. It is the son and daughter who have split up the responsibilities of caring for their father, who is housebound, so he can continue to live in his home in a remote rural area, which make them family caregivers. The examples are endless. And the valuable role of this family caregiving has been very apparent during the COVID-19 pandemic. During this pandemic, we as a society and the healthcare system have relied heavily on family caregivers to support care of people in their homes in our attempts to reduce admission to hospitals, to long-term care, after discharge from hospitals, and particularly during periods of isolation. Family caregivers have been expected to take on many tasks previously provided by healthcare system to address a public health need to prevent the spread of this virus. What does family caregiving look like? Family caregivers provide a wide array of activities. They help with basic functions such as dressing, bathing, feeding, toileting, or could be supporting other essential needs such as housekeeping, preparing meals, providing transportation. They often provide emotional support, companionship, socialization. Their support can be in the form of financial management. The one area I would like to emphasize, which is particularly challenging for family caregivers, is providing support in the area of healthcare, which can be a whole array of needs such as medical appointments, tests, supervising medications, monitoring symptoms, managing behaviors and crises, navigating the systems of care, and advocacy. Why does family caregiving become burdensome? As a society, we believe in caregiving. It comes from a place of love, duty, reciprocity. It can be fulfilling and rewarding. However, it is the load and length of care that can have negative consequences. It is also important to recognize that while there can be many family members and friends, it may be just one or two providing most of the care. There is considerable evidence that family caregiving can have significant negative consequences. It can cause emotional distress, isolation, caregiver burnout. It can result in mental illnesses such as anxiety, depression, and even suicidality. It can have a negative impact on the caregiver's physical health and decreased longevity. It can be a reason for enormous financial hardship. 60% of family caregivers in Canada are working. It can lead to restriction of work hours and exit from the workforce, and sometimes altogether. It can affect their careers, income, and aspirations. Let's take a moment and look at the extent of caregiving in Canada. Currently, 25% of Canadians are caregivers. They are of all ages, providing care to all ages. They provide 1.5 billion hours of care, 10 times more than provided by paid care providers, replacement costs of which amount to over $65 billion a year. They're rightfully recognized as the shadow workforce of our society and the backbone of our healthcare system. And this backbone needs support. We need family caregivers to provide and sustain care. As the population ages, there are increasing numbers of us living longer with chronic and progressive illnesses. We also know that majority of Canadians prefer to live at home as long as possible and depend on family caregivers to support them. At the same time, our healthcare system is trying to reduce the costly and avoidable acute and facility-based care by shifting care to the community, which means more care needed from family caregivers. In response to this shift, many well-meaning initiatives and research are focused on training family caregivers to provide care with the intent of sustaining care. What we have not done is asked, what is all this doing to the health and well-being of family caregivers? Family caregivers are saying to us that you're increasing the load of care and adding to their stress. They are not saying that they want to stop caregiving. They are saying, stop trying to build a better caregiver. Instead, build a better system around us to support us. I was on the same path. Being a care of the elderly physician, I was very confident in my interactions with family caregivers. I was engaged with them in my assessments and implementation of recommendations. It was 2013 that I had an awakening for two major reasons. By then, my parents had immigrated to Canada, and I found myself providing considerable support to them, even though it was my mom who was the primary caregiver. I found myself supporting them in a myriad of ways, taking them to medical appointments, taking them to specialists, getting various tests done, picking up medications, trips to community physio, addressing equipment needs, and then running errands and taking multiple calls from them during the day. I became frustrated, particularly when navigating the healthcare system. I became angry, and I regretfully directed my anger towards my mother. I was stressed and recognized that I was failing to cope. At about the same time, I became the medical lead for home care in Edmonton zone and started to get a better idea of how much we depended on family caregivers to provide care. I began to work with fine community organizations such as Alzheimer's Society and Caregivers Alberta in how we could prepare family caregivers to provide and sustain care. Till one day, I was asked, what are you doing for family caregivers themselves by the director of Caregivers Alberta? I was giving my usual spiel that I collaborate with them, spell out my recommendation, lay out my expectations when I was pushed back with. Have you ever asked a family caregiver how are they doing? I was completely nonplussed. I realized that I was purely using the family caregivers to care for my patients, and I was not thinking of the family caregivers. In that moment, everything fell into place, my own experience, my way of work, and it dawned upon me that we have to do a much better job of supporting family caregivers from within the healthcare system. That was 2013. And fortunately, because of tremendous support from 400 stakeholders, many of them family caregivers themselves, healthcare professionals, managers, policymakers, researchers, community organizations, and government ministries, we've explored the role of healthcare system to support family caregivers. We recognize that family caregivers are unintentionally marginalized in our healthcare system, which is mostly focused on patient care. We learned throughout the care trajectory, the healthcare providers underestimate the caregiver role and stress and miss opportunities to prevent and reduce that stress. We uncovered that there was a gap between what family caregivers report they need from us and in the preparation of the health workforce to meet those needs. The overwhelming voice was that we have a duty and a responsibility from within the healthcare system to support family caregivers. There was universal agreement that we need to prepare a health workforce to recognize and support family caregivers. We coined a term, caregiver-centered care, which is basically person-centered care for family caregivers and validating the core competencies to train the health workforce to support family caregivers. Let me share these with you. They begin with recognizing the caregiver role, identifying the family caregivers, their contributions and consequences of caregiving, communicating with them in a timely and a respectful manner, partnering with them, establishing collaborative relationships, and including them in care planning and decision making. Fostering resilience in family caregivers is about identifying caregiver needs from their lens, facilitated by the healthcare providers. Having identified their needs, then helping them with navigating the health and social systems of care, accessing supports, and overcoming barriers. finally, enhancing the culture and context of care, which is about role modeling and engaging in self-reflection to build meaningful relationships with family caregivers. We are very excited as we are about to release the education modalities and resources that will serve to provide foundational education to healthcare providers based on these core competencies. These are going to be tested in all healthcare settings: primary care, acute care, home care, supportive living, long-term care, and training institutions. We are quite ambitious. We are setting the stage for all healthcare providers in our healthcare system to be educated as we recognize each and everyone has a role to play. In conclusion, I would like to say that our ultimate success will be measured by family caregivers when they feel supported by us throughout their caregiving journey.